Could one lifestyle shift cut your disease risk dramatically? For millions, chronic conditions like diabetes, heart disease, and certain cancers feel inevitable. But emerging science and decades of public health research reveal powerful natural ways to prevent them. This documentary explores the problem, the science, and practical steps you can take today. We begin with a simple truth. Chronic diseases are driven by long-term exposures and daily choices. Sedentary time, low-quality food, chronic stress, poor sleep, and environmental factors accumulate over years. Communities with limited access to healthy food and safe spaces for movement face higher risks. That's the problem. Slow, cumulative harm that's easy to ignore. Now the science. At the cellular level, chronic inflammation, insulin resistance, oxidative stress, and changes to the microbiome are common threads linking many chronic diseases. Lifestyle factors strongly influence these processes. Regular physical activity improves insulin sensitivity and lowers inflammation. A plant-forward diet rich in whole foods supports a diverse microbiome and reduces oxidative damage. Sleep restores metabolic balance and immune function. Stress management calms chronic hormonal signals that drive inflammation. Small, consistent habit changes create measurable biological shifts within weeks and powerful disease risk reductions over years. Evidence from large population studies shows that people who follow 5 key healthy habits, regular exercise, a whole food diet, not smoking, moderate alcohol use, and healthy body weight have dramatically lower rates of heart disease, type 2 diabetes, and several cancers. The good news, you don't need perfection. The goal is meaningful, sustainable change. Here are practical, science-based steps anyone can start this week. First, move more in ways you enjoy. Aim for at least 150 minutes a week of moderate activity or 75 minutes of vigorous activity, plus strength training twice weekly. Break sitting with short walks every hour. Second, prioritize a plant-forward, minimally processed diet. Fill half your plate with vegetables and whole grains. Choose legumes and lean proteins, and replace sugary drinks with water or herbal tea. Third, improve sleep by keeping consistent bedtimes, limiting screens before sleep, and creating a dark, cool bedroom. Fourth, manage stress with daily practices like mindful breathing, short meditations, or nature time. Fifth, nurture your microbiome with fiber-rich foods, fermented foods, and prudent use of antibiotics only when necessary. These changes also protect your mental health, energy, and longevity. For people with chronic conditions or medications, work with clinicians to adjust plans safely. Community and policy matter too. Advocating for safer streets, accessible parks, nutrition education, and affordable healthy food amplifies individual efforts. Technology can help. Simple habit trackers, guided meditations, and telehealth make healthy choices easier to sustain. Real people show it works. Stories from communities that increased access to fresh produce and created walking programs demonstrate lower disease rates and better well-being. Small neighborhood changes scale into big public health gains. Expect obstacles, time, habit, stress, and socioeconomic barriers. Overcome them by setting tiny, specific goals, finding social support, and celebrating progress. For example, swap 1 sugary drink for water each day, add 1 vegetable to every meal, or walk 10 minutes after dinner. Track results and adjust. The timeline matters. Within weeks, you may notice improved sleep, mood, and energy. Within months, blood pressure, blood sugar, and weight often improve. Over years, cumulative risk falls substantially. Prevention is both personal and political. Building environments that make the healthy choice the easy choice multiplies benefits across populations. Remember, prevention is not a moral judgment, but an act of care for yourself and your community. To get started this week, pick one habit. Move more. Choose whole foods. Sleep better. Reduce stress or boost fiber. Create a simple plan. Tell a friend and review progress after 30 days. These are small, sustainable steps with outsized health returns. Preventing chronic disease naturally is not about perfection. It's about steady, science-backed choices that add up. The evidence is clear, and the power is in your daily routines. Start small, stay consistent, and influence the world around you for safer, healthier communities. Start small today. Choose one habit and commit for 30 days.